Hi, my name is Mindy Young, and I am a telemetry nurse at Carolina's Healthcare System BlueRidge in Morganton. And this is my SWOT analysis. I did it on Carolina's Healthcare System BlueRidge. Carolina's Healthcare System BlueRidge, our mission is to enhance life by excelling in care. The vision is to be the best community healthcare system in America. And the values are commitment, integrity, respect, excellence, and service. And I know it's hard to see these slides, but the PowerPoint will be submitted as well so everyone can see it a little better. Some of the strengths of Carolina's Healthcare System BlueRidge are the size of the corporation. We have many facilities ranging from doctor's offices to one inpatient hospital, rehabilitation facilities, pain management clinic or pain clinics, cancer center, many different areas. We are also a part of a larger corporation, the Carolina's Healthcare System. We are also a teaching hospital. We have residents, and we also have nursing students from many of the surrounding universities. We do have shared governance. We do these meetings, and this is an area or opportunity for teammates or the employees to come in and have ideas and come up with new processes or new changes on the unit. We do have experienced nurses. There are more experienced nurses in some areas than others. Our more experienced nurses tend to be OR, PACU, the pain clinic, cancer center, stuff like areas like that. Another one of our strengths is a lot of our processes that we implement are based on evidence-based practice. We just recently started a new process where the unit nurses are going down to the ED to pick up our patients. While in the beginning we believed that it was unsafe to leave the rest of our patients up on the floor while we went to the ED to get our new patients, it actually has turned out to be a pretty decent process, and it was based on evidence-based practice. This allowed us to be able to see our patient before we actually brought them to the floor, because many times a patient would be brought to the floor and rapid responses would have to be called as soon as they arrived on the unit because we weren't able to see them before they were brought up. Some of the weaknesses are staffing. I believe this is in every hospital and every facility. A lot of times we get floated to different units. This is a major complaint. Sometimes some nurses or any other type of CNA, anything, gets sent to another floor, and it leaves our unit short-staffed as well. So we're taking staff from some floors and sending them to other floors, and it's leaving the floor they came from short-staffed. We do have a lack of reliable technology or vital signs machines. Our computers, my unit, telemetry unit, currently uses the computer on wheels. One of our most recent requests were to have computers put in the rooms. We saw the computer on wheels as a bit of a safety hazard. They're big, you can't see while you're rolling them down the hall. It's easy to run into people or other things. We realize that while this will cost money, and at the same time it's a bit of a patient and staff satisfier, so it could the higher the patient satisfaction, higher the income. Another weakness is communication between physicians and nurses. At this time, we switch off physicians every Monday. They work 7 days on, 7 days off. At this time, I call them the A-team. There is a group of physicians that works 1 week who have been working together for many years. They have great flow. They have great communication with the nurses. They have great communication with the patients, and rarely do we see complaints that week. The next week are physicians who have not been there as long. They haven't worked together as long. they don't communicate as well, and that week it seems as though we are making more phone calls to figure out a patient plan, to answer any questions a patient has, because these physicians have neglected to answer those questions. And they also have neglected to tell the nurse what the plan is for the patient. Another weakness is having to do more with less resources. Again, I believe this is at a lot of facilities. Many times you're having to do more with less resources, and that's including short staff. You're having to take more patients because you don't have enough nurses. Another weakness we have specifically at Carolina's Healthcare System BlueRidge is lack of specialty physicians being available when we need them. Currently we only have one neurologist. That one neurologist cannot be on call 24/7. It's impossible. So if we have a patient come in with a stroke and he's not on call, sometimes this patient won't be seen right when they need to be seen. Another specialty physician that's not on call all the time is pulmonology. Sometimes a patient will sit in the hospital all weekend long waiting to see the pulmonologist on Monday if they come in late on a Friday evening. Some other weaknesses on top of the lacking the physicians in specialty areas, we also lack the staffing to run the technology, the machinery that some patients need for testing. For instance, on Sundays, the staffing for our MRI machine goes home at 12 noon. This has been a major complaint. We feel as though a patient can have a stroke at any time of the day, and they need to be or have the technology, the machinery available 24/7. Another thing is patients who come in with chest pain or anything indicating an MI. If you come in Friday morning after about 4 o'clock in the morning, some patients sit there until Monday morning when cardiopulmonary and nuclear medicine come back, and they can have their stress test on Monday morning. Another weakness is nurse turnover. In the 3 years that I've been on this telemetry unit, there has not been much turnover up until recently. Recently we had a great deal of turnover, and there was a great deal of nursing shortage, so we had to call on many traveling nurses to help pick up and help staff the unit. That in turn caused us to have a number of inexperienced nurses. That's one of the weaknesses, I believe. A number of inexperienced nurses compared to a number of experienced nurses. On telemetry and med-surg, it seems as though we have more inexperienced nurses than experienced nurses. Sometimes it's very unsafe. Sometimes you have, maybe we'll say, a night shift where you have maybe one experienced nurse with the rest inexperienced nurses, and that can definitely lead to problems. Some opportunities that are offered are tuition reimbursement. This gives incentive to go back to school, get higher education. The aging population is also an opportunity, I believe, because the aging population will call for more nurses. The nurses will be in more high demand. We are working toward magnet status at this time. We're trying to implement new processes, such as it's called IDM. We have a huddle every morning. Every physician, every nurse, PT's there, social work, case management. Everyone is there to talk about every patient on the unit. We also do a safety huddle with every nurse, charge nurse, CNAs on the unit every single morning to discuss each patient's care. Obamacare is also an opportunity for the patients who were previously uninsured. They are now insured, and so that gives them more of an incentive to come to the hospital instead of just not going to the doctor and not getting checked out whenever they're ill. Another opportunity is a less readmission rate. We just got a grant to our hospital, and we're doing a study. We ask the patient each time they're discharged what their confidence level is based on a scale from 0 to 10, 10 being most confident. We ask them this question on how confident they are in their health and taking care of themselves once they get home. If they give a number below 7, we're supposed to ask what we can do to help that number increase. These same people who are reviewing all of these numbers, all of these patients, are also making more phone calls, going out to see the patients. Personally, I believe it has helped so far. I believe that the readmission rate has decreased since we began this. Opportunities are always technological updates. We could always use better computers, better machines. It just makes workflow much easier. Threats are, I believe, government requirements, HCAHPS being an example. Patient satisfaction can be a very stressful thing sometimes. Personally, at Carolina's healthcare system, BlueRidge, it seems as though the pain management score just cannot come up. It is very frustrating for nurses to try their hardest and keep people's pain under control, and a patient still say, no, that's not helping. But when their blood pressure is dropping, when they're asleep and you go in and they wake up right out of their sleep and say they're in pain, and then they go right back to sleep, these things aren't considered when they're asked after follow-up after they're discharged if their pain was controlled. It's very tough. Budget cuts are a threat. At Carolina's healthcare system, BlueRidge, it seems as though we are always trying to cut costs in any way possible. If we do get low census, we are trying to send nurses home. There's a magic hour, about 4 o'clock in the afternoon, and if we decide that a nurse is going to go home, they are sent home and tried their hardest to get sent out by 4 o'clock in the afternoon. A threat is also the aging population. I know it's an opportunity, but it's also a threat. With nurses in such high demand, and we do have a shortage of nurses, it's a little bit worrisome about the aging population, because the baby boomers are going to hit hard. They're going to be more sick, and we're also not going to have enough nurses to take care of them. So I believe we'll be doing more with less resources as the baby boomers age. Traveling nurses are also a threat. When we had turnover and we were trying to get our inexperienced nurses trained and ready to be on their own, we did have to hire quite a few traveling nurses. At that time, our census actually dropped. Many traveling nurses have a contract that say that they cannot be put on call or put on low census if at all possible. At this time, the traveling nurses were basically staffing our unit. We were having to put our own people on call and on low census every single day. Recently, during a shared governance meeting, they actually decided to not re-sign or ask the traveling nurses to come back after their current contract ended. So now we are fully staffed on our unit with only hospital staff. Another threat is increasing healthcare costs. Everybody's worried about healthcare costs. The insurance deductibles are going up. It becomes very, very worrisome to people to have to pay that amount before their insurance will kick in. If you have to have any tests, I've had people, I've asked them, do you want Tylenol? They said, no, that Tylenol is probably going to cost me $10. No, I don't want that. I'll just suffer. And I don't believe that that is a good thing. Hopefully over time this will change and get better, but that's asking for a lot. And my references were just BlueRidge Healthcare's website that explains where the mission and the values and the vision are. If you have any questions at all, please ask, and thank you for watching.